Stealth infection. So what I've done here is included symptoms for a lot of the different stealth infections, and then in subsequent assessments, I go into each one of the stealth infections. So if you have insomnia or sleep problems, if you have fatigue, if you have cognitive dysfunction like brain fog or memory loss, urinary symptoms, either pain with urination, urinating at night, urinary urgency, where basically when you think about urinating, you have to urinate, or when you know you have to urinate, you have to do it now, and frequency, meaning you urinate a lot. Temperature changes, so cyclical fevers, day or night sweats, cold hands and feet, and muscle pain, so neck pain, headaches, muscle cramping, especially in the calves and feet, and foot pain. Joint pain, so joint pain that moves around the body, it's migratory, so one day it might be in the elbow and the next day it might be in the wrist. And non-migratory, so some that just stay in one joint. Knee, foot, hand, hip, shoulder pain. Mood issues, so depression, anxiety, and then more severely, panic attacks and suicidal thoughts. Neuropathies, so numbness, tingling, shooting pains, electrical shocks through the body. Hormonal deficiencies like adrenals, thyroid, sex hormones. Symptoms that move around the body and change in quality from day to day. That's an important markers we'll talk about in a little bit. And then the tests to do are going to be the multiple pathogen immunoglobulin blood test. And so that's looking at a lot of the viruses, and that's looking at, it's a serology test, so it's looking at the immune system's reactivity to these bugs. You want to do and the DNAconnections.com test. So the Lyme panel that is a urine PCR test. That test is the only test that's not found at orderlabs.fixyourfatigue.org. Now that Lyme panel does need to be provoked with either a lymph massage or 30 minutes of exercise just prior to collection. And then the laboratory data, so if you've got elevated immunoglobulin, so if the immune system is reacting to those these different bugs, Epstein-Barr, Mycoplasma, Chlamydia, Cytomegalo, human herpes virus number 6, that's considered significant, and we'll get more into that and those specifics. And then the presence of Bartonella, Borrelia, or Ehrlichia on the urine PCR test through DNA Connections. So education. In my experience, it is very likely that someone has a stealth infection if they have 2 or more of the above symptoms and the indications on laboratory testing. So to determine which infection you may have, please proceed to the next sections that go into more detail on the individual infections. And then conclusion, determine yes or no if you believe you have a stealth infection, and then we'll get into more specifics so you can determine exactly which one you have.